this week's episode, we are talking about dog dental health. February is Dog Dental Health Month, and a healthy mouth is a healthy dog, just like people. So let's get into it, and you're going to hear some of the stories that people are telling about what happened when they neglected their dog's teeth and their dog's dental health. Let's get into it. Type teeth in the comments, and you'll get a link directly to my little ebook that I put together with a little bit about Jozee's story. You can go to my website and catch the blog there, where the signs of dental health are very, very subtle. It's not like all of a sudden she can't walk, or how those sorts of things happen. They're subtle. And first of all, it's kind of like, ooh, stinky breath. And remember, if you're just joining us, type teeth in the comments and you'll get access to the ebook that we put together on dental health, what are the common myths, 5 signs to look for, and the difference between vet cleaning and the cosmetic cleanings, the people that can come to your house. That has its benefits, but that's not really good, solid, reliable dental health. And also tips to keep your dog's teeth clean at home. And Jozee's story's in here. And I'm not, I'm not proud of it, but stuff happens. And it's because you're training, but why does training and dental health, why would we even have that conversation at the same time? Well, here's why. I mean, Jozee's like the shoemaker's kid. She doesn't have a whole lot of training anyways. If a dog is in pain, think about this. Have you ever had a toothache? Have you ever had a root canal? That kind of like, that sort of thing, or really bad toothache. I've got TMJ right now, which is whatever it is. Anyways, my jaw locks, and man, I tell you what, it's uncomfortable. So there's times if I'm doing something, and I know why it happens, it's because when I'm doing something, I'm into it. But, you go to do something and open your mouth and it grabs, so it takes away your focus. Imagine a dog that's had a constant headache because wherever she went, that's what it is, and they can't focus. So if all of a sudden your dog is acting differently, maybe it's not loving its food the way it used to, maybe you go to touch its face and it snaps at you, backs away, yelps, but first thing you're going to think of is an ear infection, but there's a good possibility that they've got a dental infection. So my point is this: when someone comes to me with a sudden behavior change, and I see that sensitivity around the face, I'm not going to train the dog, and I'm not going to take their money until they've gone to the vets and had their mouth looked at, had the dog's mouth looked at, because they're connected. When the dog is not feeling well, they are not going to be interested in training. They're not going to give their best performance. And no dog does things wrong deliberately. There's usually some underlying reason. So that's that's why we're having a discussion. That's why a discussion of training and a discussion of behavior and related to dental health matters, because they are connected. The whole nervous system is connected, and it isn't just about the dog. When people say this, my dog's just being stubborn, he won't sit or he won't do something. I want to go right back down deep into what's going on. And Jozee's problem lasted probably 3 years before I did really anything about it. And it was just, I finally just knew her front teeth started to fall out. So I just knew it was time. And you can pass it off. Some breeds are more prone to dental problems than others. Chihuahuas, Pomeranians, smushy faced dogs like bulldogs, Boston Terriers, they can all be known for plaque buildup no matter what you do. You can brush the teeth, they still have plaque buildup. So you have to be prepared for that. Not every dog in every breed, in those breeds, has that issue, but those are the breeds that are most prone to it. Like Prince's teeth are pearly white. I've got Max back here, the golden retriever. His teeth are shiny white. So you say, well, I feed them raw. Yes, you can feed them raw. That helps. Raw food, yes, helps. But if the dog is going to get a plaque buildup, it's going to get a plaque buildup. And the way to find out about that and then learn what to do about it is on your annual, or if you go twice a year, that's fine. But at a minimum, once a year, oh yeah, she's tormenting her. That's what you call obnoxious behavior. And put teeth in the comments if you want a copy of this book. You can read all about it, because I can go through and I can quote them to you. I just give you kind of the highlights, but it's in big print. It's easy to read. So one of the tips to keep your dog's teeth is brush them, use dental chews or bones. There's additives you can put in the water, but I'm going to tell you, I have them and I put them in the water, and then the dogs won't drink the water. They just won't drink it, because it's got a different smell. So that doesn't work. I do plaque busting additives. There's something called plaque off. Yeah, plaque off, and it's gritty. So when they eat it, it's kind of like grinds on the teeth. And I have a cockapoo client that brings that. So I've actually started using it here with our dogs because of her. It does help. But the most important thing that you can do is just regular vet checkups. Let your vet look in the dog's mouth. If you don't want to do it or they don't want you to do it, the vet will do it. Even if they have to, relax them a little bit, it's better than not doing it at all. And the vet will insist on it because it's important. When they have a mouth infection, a tooth infection, a gum disease, there's bacteria coming out of that's causing the infection, and when they eat, they're swallowing that. So they're infecting their whole system. So that's why it's important. And celery and cucumber for sure, and carrots too. Anything that kind of gets into doesn't build up in their teeth. The other thing to remember is that it does sneak up on you. So the question, that's a great question. Thank you. How do I introduce the toothbrush so that it's not a game? That's a good question. What I use are those little things that go over your finger, because I find by using the toothbrush, as soon as you start to move it, the dog is. Let me get my. The dog's gonna bite it. So I put the tooth. I don't do Jozee's teeth, but I put that little. It looks like this is a splint, but it put a little it looks like a thimble, but it's got nubbies on it, and then put the doggy toothpaste on it. And then you just go in and you can reach right in, like you just put your hands there, and then they smell it, they start to lick it, and then you can just put your tooth or your finger right up under their teeth, and you just massage their gums. You don't try it. That's what I like about the little finger thimbles rather than toothbrush, because then you just massage their gums. And if you do it every day, pretty soon they like it. But I'll tell you, I can remember one of my coworkers a long time ago had a yellow lab, and she brushed his teeth every day, and she fed him carrots and cucumbers and apples and all the good things, and he still ended up with gum disease. Some dogs just get it, and the best way to prevent it is to go with your vet. Yeah, you know what you can do, Pierre? You can also, if you don't have one of those things just yet, just use a washcloth to start with and put like peanut butter or something on it, just so they get used to you touching them. It isn't about getting all the stuff off at the moment. If you've never done it, you want to start really making it like a fun thing. Do it either just before or just after dinner. Then you can give them something healthy that they really like afterwards. Okay, so I'm going to get to your question. If you got a question, post it in the comments. And if you want to know, I mean, I can read this to you, but I think you're all capable. Type teeth in the comments. You get instant access to this. We had great response when we first made the announcement on my Instagram page. Lots of people opted in to pick this up. There's no cost for it. But, if you do want more help, if you do want more guidance, if you're having trouble, as the one fellow asked about how you get them used to the toothbrush, I don't. I use I put a washcloth to start with, like a terry cloth one, so it's rough, and then that actually should be in here, but it says toothbrush, so that's a good amendment. I'm going to add that how to get started, how to keep them clean, but I'm going to amend that, how to start. And I'll actually do a video on that, and I'll put the link in the booklet. So when the update's ready, we'll get that out. Maybe the next time we talk about dental health. So you just get them used to having it happen at the same time every day for a happy time. All right, so D. Saudi says, we have a new tiny puppy, and our 4-year-old golden doodle snaps and growls at him. How do we acclimate them properly? Well, keep the puppy out of the 4-year-old's face, for one thing. He's not comfortable with him in his face. What he's doing, he's being a good dog, because good dogs give warnings. And he is warning, and he's warning the puppy, and he's telling you, I don't want you in my face. And snapping and growling, the puppy should back away. And the instant you see or hear that means you've missed something, but it's not too late to come back in, and you look at the golden or at your doodle, and you go, that's a boy. And you take the puppy and you walk him away. You're not telling the doodle that he's being good for growling. You're telling him, you're sending a message that you've got his back, and you appreciate that he let you know that he wasn't comfortable, and you will take care of it because you are the leader of the pack. And going forward, if you should have a line on your puppy in the house, a drag line, just an 8-foot line with no handles on it. And if needed, you just put a clip on that, snap it on your belt loop or around your waist, and then you just have the puppy follow you. And if you can't supervise him around the golden, then you put the puppy in the crate and you let the doodle stay out. But good dogs give warnings, and you want to let your golden know your doodle know that he's not being replaced, that he is still the apple of your eye. The puppy is a newcomer and he's sticking around, but he still has to follow the rules. And both dogs should look at you as the boss. And all you do is you communicate to them in their language. That doesn't mean you yell at anybody. If you yell at the golden doodle, so this is for all of you that have a multi-dog household or you want to introduce a new puppy. If you yell at the dog that's just given warning, what you're doing is you are setting the dog that you're disciplining the wrong dog. And what will happen is they'll get faster and they'll get silent. A dog that doesn't make noise is a very scary thing indeed. That's your big threat. Good dogs give warnings. That gives everyone a chance to respond and respect. And if you correct the dog for growling, you're going to set that dog up to go, wow, Jesus, I don't like this thing in my face. No one's helping me, so I'm just going to take it out. Because they're predators. They're not, little baby boys. They are predators. And if something is in their way, they will take it out. Because every dog's number one priority is to focus on their own security, their own survival, their own safety. And if you can't do it for them, then they have to do it themselves. And you can do it for them by simply interrupting that and basically moving the puppy away. That's the form of discipline to the puppy, not disciplining the dog that made the sound, because the dog that made the sound is communicating. That's information, right? So back to the teeth. What about the toothpaste? That's a great question. Do not use human toothpaste on your dog. Get doggy toothpaste. And it's meat based. And even if you don't do that, you can use mild solution of baking soda and water and just do that. But I would just get doggy toothpaste. Even if you just take the little thimble with the knobs on it, or a dishcloth or like a face cloth that's terry and kind of rough surface, and just every day, you don't need the toothpaste, and you're just breaking up that plaque. But if you want toothpaste, get the special doggy toothpaste from the pet store. Don't use regular toothpaste. Yeah. Oh, you're welcome. And keep us posted on that, because you've got a good dog there for sure. So the puppy needs to know that. And what you'll find, the more you interrupt, the more respectful the puppy will be with the older dog. And pretty soon they'll be buddies, because everybody knows the rules. Consistent, no emotion, no yelling, just body language, just moving in. If Prince was the doodle, you see him over there, you just move between and you put your back to the big dog and you move the puppy along, and you can turn around and go, that's a boy. Thanks for letting me know. And away you go. That's how I would handle that, because otherwise you're just setting him up. Okay? Okay, if you're just joining us tonight, welcome. And type teeth in the comments if you want a copy of this ebook that we put together on dental care for your dog, because, and I've already had some good suggestions on some amendments to make to this. I appreciate that. And also because February is Doggy Dental Health Month. And for those of you that don't know, I neglected that with Jozee, and if I had have paid attention or acted sooner, basically if I had have acted on my vet's advice sooner, I would have saved her a lot of grief. She was eating the right food, she got chew bones, all those sorts of things, but some dogs are just more prone to plaque on their teeth than others, and if it's left to build up, it creates gum disease, and the gum disease can go down into the roots. And in my blog, if you go to my website, OntarioDogTrainer.com, in the blog there, you'll see pictures of the before and after. And her teeth were nasty, and her breath let it go. Imagine, so think about this. I don't know how many of you here, I'm not a smoker, but if you're a smoker and a coffee drinker and an alcohol drinker, and you go on a bender the night before, and you wake up in the morning and you drink coffee and you smoke cigarettes all day and you don't brush your teeth, and you do that day after day after day, how many people want to get near you? Not many. And what's your mouth going to feel like? So think about your dog living like that all the time. And the best way to avoid that is to make sure that you watch for that plaque build up, and when it starts to build up, get it off. Sometimes using a toothbrush or a little finger, they're only they're not even that expensive, like $5 or $6 at the pet store, where you can get a tube of doggy toothpaste and it's like a thimble that goes over your finger and has little nubbins on it, and you just reach up and you just massage their gums. And if you want to prepare them for that, do it with your finger. Do it with puppies, with just your finger. You reach in and you just massage their gums until they, oh, what a good boy, what a good dog. And you just massage their gums all around with just the end of your finger. And then wash your hands or whatever. But that just gets, it activates the gums, so it keeps the enzymes going in the mouth that break that stuff down, so it will be slower. Now with Pippi, for example, wherever she went, there she is. There's no way I'm reaching into her mouth. Just ask her. She'll let you know. With Prince, probably could. With the golden, yes, but with her, not happening, right, Pip? All right, so type teeth in the comments if you want if you want a copy of this book on dental health care, because February is Dental Health Month. And if you have some questions related to dental or anything, post in the comments. That's what we're here for. If you want, if your questions are, you think you need some more than just that, then click the link in my bio and we can do a quick assessment call. You can book one-on-one here with me if you live close by, or if you want, I talk to people all over the world. We can book online coaching assessment calls. I have a 15-minute assessment and audit. I can determine and set you up for a path forward that's going to help you with your dog have the life that you want. But right now, if you want a dental plan, just type teeth in the comments and get version 1 of our doggy dental book. Okay, I don't see any questions. Am I missing something here? And so we're talking about dental health care because February is Doggy Dental Health Care Month. But what other topics? Put in the comments some things that you might want to talk about. The other, we have kind of a list of things. The questions go in waves, but one of the things that we had, that I've been asked a lot about lately is my dog doesn't have an off switch. And so many people get their puppies, they think they got to keep them busy all the time, or they think they should be quiet all the time. So last week we talked about the fulfillment formula, and I did do a blog on what a fulfillment formula looks like, and that's how you build in your off switch. But we're going to talk more about some specific exercises on how you can settle the dog once their needs have been met. Okay, so we've got a question here. My toy poodle has always had bad breath, and her teeth do have buildup, and I've tried toothpaste, but it doesn't help. She's only 3, and it's been like this since she was about 1. So my question would be, what does your vet say about that? Because when there's a plaque buildup, it's pretty hard to get it off without a surgical procedure. Now, if you take her to the vet, they often take, just like your dentist does. Have you ever had your dentist scrape your teeth with those metal instruments? It makes me cringe. But dentists will do that with the dog. And my vet did it with, one of my labs one year, because he had plaque buildup way at the back. And it came off just like chunks of enamel, but it was plaque buildup. And if your poodle is 3 now, and she's had that since she was 1, I'd be asking your vet to have a look in her mouth and to give you some advice on what they should do, because they might recommend a cleaning. And yes, if you have insurance, insurance covers it. If you don't, make sure your vet knows that, because many vets have different rates for with insurance and without insurance. And the cost, I don't know, because like I say, I was advised here's the thing, when I was advised we should get these teeth looked at and cleaned, there might be some that have to come out. That was just before the pandemic. The estimate was $1,250, something like that. So $1,300. Okay, well, I'll get to it. I'll get to it. So then I waited and I didn't get to it. And then when I finally had it all done, it was close to $3,000 because she had to have 21 teeth taken out. So PSA Marcus, they're recommending a cleaning, but she's young. She's not young. It doesn't matter. If she has all of her permanent teeth, she is at risk. She is at risk of gum disease. And once they have gum disease, then you're going to lose teeth. Do it now while she's young, because her teeth are strong, and that'll help keep them strong. If you let that plaque build up, it weakens them, and then they get gum disease, and then it gets down into their system, and then you've got a whole host of issues. My toy poodles always had buildup, started when she was 1. So, yeah, and the toothpaste, sometimes the toothpaste doesn't work. It doesn't. I would just... even the guy at the pet store a long time ago, when I was asking about it, he said just massage their gums to start with a not sandpaper, but with like a terry face cloth. But at 3 years old, that's 3 years of plaque buildup. And yes, you've been brushing your teeth, and good for you. And earlier on, if you weren't here, one of my coworkers had a lab. Labs aren't prone to bad teeth. And what happened is she would clean the teeth. She'd give her healthy snacks. He still had plaque buildup. He lost about eight or nine teeth. The concern is, if you get it done now, I'm not even sure they have to use total anesthetic, that they can't just give her a relaxant and go in and clean her teeth. But they'll use instruments. Like it's a medical procedure with dentists, or with vets. Whereas you have a cosmetic groomer or like a cosmetic tooth cleaning specialist come to your house, and there's tons of them around. They don't go deep enough. They probably would do what you're already doing. They may be able to get down and scrape some of the stuff off, but they won't put the dog under. Your vet will at least give it a relaxant so that they can get into a deep cleaning. And then they may take x-rays if needed. Maybe the first time you go, it might be expensive, but if you go then routinely, it won't be. So it's worth getting it done. And then it's going to give you peace of mind. And people say, well, I'm worried about putting her under the anesthetic. I'd be more worried about gum disease getting in and that bacteria getting into her system. So, nylon chew bones. So, you know what happens with those? It's funny, the nyla bones, I don't have any here anymore. I just use regular bones, but then there's some issues with those too. But the nyla bones and the nylon chew bones, I kind of like them because people often take them when they get rough around the edges. You know, they'll get like little threads, and they cut them off. I leave them because they're actually like dental floss. If you want to give your dog something that's healthy and that acts as dental floss, frozen chicken necks work really well, but you have to hang on to them. Raw chicken necks. You have to hang on to them, and then you turn them in their mouth. I have a picture somewhere of a little puppy that was here, and I taught him you have to teach them how to eat those chicken necks properly, and they'll chew them, and they're just like dental floss. They get in between your teeth and you know, the little fine bones, and floss out their teeth. But nylon chew bones, especially the little knobby ones, and if the dog will chew them, because they'll get them along the side of their mouth and really chew on them. If you find that they're chewing too hard and they actually start to break large chunks off, and they got to be pretty hard chewer to do that, you take them away. So because I feed raw, I'll give my dogs raw marrow bones, and I'll let them chew the marrow out. And then when they're finished, I stuff this with their food, the raw food, and I freeze it, and that's their nighttime snack. Now, I manage this because your vet will tell you, and it can be true, if you've got a hard chewer and they really crunch down on this, they'll crack a tooth. Mine don't happen to do that. They lick them, and then when they start to, you can see this one's starting to almost be ready to be thrown out. Prints will sometimes start to break. As soon as I see a piece break off, I throw it out. So you've got to monitor that if you're using these kind of bones. But they do. I have little tiny ones that I use for the little dogs, and they're fine, because usually what happens is they'll just leave them alone. And then after a while, the nylon chew bones, they might work on them longer, and they're softer, so they're easier on their teeth. So I highly recommend that. Yep. My dog has oral melanoma, and if I had gotten her teeth cleaned regularly, they would have seen the mass, which means you could have treated it. Thank you for sharing that, and I'm sorry. Hopefully it will be not, hopefully it'll work out for you. But yes, so I wouldn't even have thought about that part because I haven't experienced it, but it's just another byproduct of not getting their teeth looked at. And I know the opposition to it, because I was one of them. It's just a racket. Vets, like, all of a sudden, how come they never needed teeth cleaning? You know, when I grew up with, as a kid, we always had dogs and hounds, and I never even thought about looking in their mouth. For one thing, I was just told to keep away from their mouth, so you didn't look in there, and you never heard of it, and you never heard of those things. But just like human medicine, technology has advanced. We know more, and we can do more. And there's a classic example, oral melanoma, and because of not getting the teeth cleaned regularly, so they didn't see it. You wouldn't see it till it shows up, and all of a sudden it starts to come out, and now you've got, what's this? Mass in the mouth, because no one's looked in the dog's mouth for who knows how long. So get your dog's teeth. When you go to the vet, now I make an assumption, and it could be incorrect, that all vets look in your dog's mouth. Maybe they don't. Mine do. So that's how I knew. But if they don't, ask them to. Say, I'm bringing her in for her annual shots, and I want her mouth. I want you to look in her mouth and tell me what I should do. They can tell by an initial visual. They don't have to take the dog right away and put her down and inspect, but some of them do, and I don't like that. I want them to give me just a visual assessment first, or even if they have to really get in deep to do an assessment, a mild sedation where they don't have to put them under, but it's worth getting it done for the health of your dog, health and well-being of your dog, so you don't end up with an oral melanoma that you could have caught earlier. All right, let me see here. A couple more questions is good. Yeah, Benji Patty, my Maltipoo has a hard time with the inside of her mouth. Been brushing for 2 years. So what do you mean by a hard time? What happens? Some dogs don't like it, and that's why I like the finger thing, when you can get your finger up inside if you can, depending on the size. That sometimes little dogs it's harder, but if you just massage, you wrap a face cloth, like a terrier face cloth around, or go to the pet store and get those thimble-like things that fit over your finger that have little nubbins on them, and you just get up and you just rub underneath, because it's soft, but yeah, there's enough variation in the little nubbins on the end that it massages their gums, and then it releases the enzymes that will dissolve some of the plaque, and it also loosens it up. Yeah, some people use I never did have much luck with a brush, I'll be honest with you, the few times that I tried it. And someone mentioned earlier that because the dog tries to bite it, it's a big game. The dog bites it when they try to put the tooth, or they see it coming. Well, think about it. Okay, here's a pen. I'm going to come at your face with this thing. You're going to bite it. You're going to try to make it go away, because their mouth is the only instrument they have to tell you to stop doing that. But when you come with your hand, you can massage their chin. You just massage all around, and then you just I always move their lips around, and then you can go up underneath. And then they get used to it. I don't know if any of you have Pomeranians, but one of the reasons that Jozee doesn't go on my RV trips with me, she doesn't go to the cottage with me, because she's outside barking at her imaginary friends. She just spins around in circles and barks. But I'm not complaining, because when she was in decline, because she had a serious mouth infection, luckily it wasn't as serious as what was mentioned earlier with the melanoma. It was just a whole mouthful of rotting teeth. She didn't do that. And I thought, oh my, she's only 9, but well, maybe that's who she is. She's old. And boy, when those teeth came out, within an hour, literally within an hour after coming home from the vet, I called them. I said, I don't believe this. She's like nothing ever happened. She had to eat special food for a few days to heal up the stitches, but it was night and day, almost immediately, how much she changed when that mouthful of rotten teeth came out. Dogs have 42 teeth, by the way. So when they said they pulled 21 teeth, I was like, yikes. And the vet said, well, it's only half. She still has half of them left. She still has her incisors. Doesn't have any of the front ones, top or bottom. And I'm not going to buy dentures for her. But it will make a difference. You might. The thing is with dental disease, it's very sneaky. Like I say, it sneaks up, and the effects are subtle. The bad breath. So you go, oh, ooh, bad breath. And we make fun of it because it's doggy breath. It's not puppy breath. Puppy breath is puppy breath. And most people love puppy breath. But it's it's almost, it's sour. It's just a sour smell. And it's not, unless they've been eating poop, it's not normal. And then, their coat, the luster goes out of their coat. Jozee has a very silky coat, and it was becoming very straw-like and very dry, even though she went to the groomers. And it's funny, because I did ask my groomer, she had these crusty eyes, and I used to, in many cases, crusty eyes are caused by poor diet, and she has a really good diet. So I asked the groomer what her take was on it, and she said, oh, I don't know, they cleaned out okay, maybe she's got blocked tear ducts or something, but no, it was her teeth, because she has no problem now with her eyes. She had goopy eyes, like really crusty eyes, and her eyes were dull, like she was losing her sight. It was all related to dental issues. When all of that got cleaned up by literally removing the bad teeth and cleaning the ones that were left, and there's still some plaque build up there now, so when she goes back in, I have them check it all the time. And our 14-year-old Havanese just was the same thing. The vet, he had a bunch of teeth pulled several years ago, and now he needs to have the ones that are still there. It's time for a cleaning, and we do it because he feels he's 14, and he feels we see the difference in his behavior. And so when it's time for Jozee to have her teeth cleaned again, I will get them cleaned because I see the difference. The difference in energy was immediate. She's a hard chewer, Benji Patty. You could use the Kong people will tell you that the Kongs work. I don't buy it. They might, but if she's a hard chewer, what you can do is I would use frozen chicken necks and just hang on to them kind of let her work them, and then when they're done, you put them away. If you want to give her a nylabone, just watch it and take it away after a little while so that she doesn't crack the teeth, because they can crack teeth. All right, so here's Michelle_VP01. What's something that you used to I can do to have my dog come back to me when I ask her, or I adopted her when she was 1.5 years. Now she's almost 6. Well, she's got some bad habits. Well, here's what kind of dog is it? Like a big, small dog, little, like here's regardless of size, but if they're small dogs, it's easier. If it's big dogs, it's dangerous. So you got to be careful. I just don't allow them not to come when they're called. Period. And how do you stop that? Well, you don't stand back and yell, "Puppy, come," and puppy doesn't come. So you say it louder, because trust me, they heard you the first time. But you've just, as soon as you repeat a command and the dog hasn't complied with the first one, you have given them the message that compliance is an option, assuming that you have taught them the command in the first place. And I teach all my commands silently to start with. In other words, I shape it, and then I label the command in the praise. So if I'm shaping a come, and that's on a long line, and I back away and I clap and I put my hands down and I have a food reward, or I do that during a mealtime, as soon as they come into me, I would say, "Good come." So they start to hear, they know good is a good because they hear it a million times a day, but come is the hard message, and they hear that it's consistent. So pretty soon, if you say come and she looks at you and you add what we call the encouragement marker, that good, come, it starts to pair together. But I do it silently first. And how do I do that? Well, with come is a long line, 10 feet or longer, no longer than 15. 30-foot lines, 20-foot lines are dangerous, and they're not as effective. There's something magical about that 15-foot. It's just far enough away that they are independent, but it's far enough away that they feel at risk. And dogs are social animals. They don't want to be left alone generally, unless you've taught them to run away. So even at 6, dogs are always willing to change if humans are willing to change. But that means it's just more work, and it has to be consistent. She should never be out without a drag line on to start with, and the minute you say, "Puppy, come," and she looks at you and then just keeps on doing what she's doing, you just calmly walk over, you pick up the line, and you back up and you go, "Puppy, come." "Yeah, good dog," because as soon as she starts coming to you, she's a good dog. The worst thing you can do with a dog that doesn't come when they're called is lose your temper. So the dog starts to come and you go, "Damn it, I told you, come when you're called." Trust me, I grew up with that with my dad, and we had a lab that used to run all over the place when my dad called him. I wonder why. Because he had a very short fuse. And I remember as a kid in my bedroom crying because my dad's on the street screaming at the dog and I'm not allowed to go out. So you have to be intentional and have a plan. So your dog's out sniffing and you're pretty sure she's not going to come because you've been in that situation before. I do a couple of intro exercises to shape it. And one of them is called the gotcha game. So still have that line on. Remember, there's always a drag line on her now until she's reliant to come when she's called. And at age 6, that might take a year of practicing every day. And if you have a fenced yard, she's in the yard, even if you just hang on to the leash and she's kind of sniffing around, and I mean 15 feet, so she's not feeling you. And then you can just walk up. You walk up, I either do hand over hand on the leash, or I'll walk up the line, put my hand under her collar, put food in her face, and then walk away. And I might do that half a dozen times. Then I'll put food in her face and I'll say her name. Or I'll put food in her face and I'll say, "Come." You want to pick something you're going to say. I would just say your name, because then you add your action commands after the name. So you walk up, grab the dog's collar, say her name. You don't ask for anything else. You don't ask her, "Look at you," or anything. And then the next step from that is, so then she starts to see and sense that your approach and your presence is a good thing. So now you start to give her a little bit of guidance. When you're ready to go, you back away, you guide with that line, and you can say her name. She looks at you, and you put your hand down, because her name is now familiar, and it means food. So you've got I do what I call a touch exercise, touch the hand. Your hand comes down as she's coming in, bang. As soon as she touches your hand, she better get something from between your fingers, and then you just keep moving on. Further away, more distractions, but insisting. And for the first, probably the next 90 days, I'd have food every single time. Then I would fade it out to every other time, then every third time, and then once every fourth time, and then maybe at the end of each walk. You've got to be systematic in how you fade out the food reward, because you're looking for that a consistency, that permanence of habit. In other words, every time she hears dog name, "Come," she's looking at you and she's making an effort. You can always turn and run the opposite way to speed it up, to make a game out of it. But if you have to do that every single time, you've got a bigger problem. Does that help? Is that helpful? Just tap on the screen if that was helpful. And if you want more on that, like I say, click on the link in my bio, and I have a whole suite of online courses that deal with that stuff. And a video library that's going to help you get through that. But we can book a 15-minute free assessment call first, so just click on that. And for those of you that are just joining us, we're just about out of time here. And if you want, this February is Dental Health Month. And we've put together a booklet that deals with myths about dental care, what to look for, and some tips to keep your dog's teeth healthy. And we've got some excellent suggestions here tonight for some things to add to this. The most important one is to get a vet checkup. But if you want a copy of this booklet, type teeth in the comments and you get instant access to it right away. Okay, so this is PSA Marcus again. Since you mentioned grooming, take your poodle to the groomer every 6 to 8 weeks. Ooh, nicked her twice already. Ooh, I'd be going to a different groomer, I gotta say. So here's the, she says, we go to a groomer. She's nicked her twice already. The last time she clipped her paw pad and didn't mention it to you, I'd be going to a new groomer. Because that's serious stuff, and that's painful for the dog. For one thing, the nicking would be painful, and then she's got to put then she's got to walk on it. So now you're creating a dog that's going to be nervous of groomers. We take our Havanese to the groomer. Well, I take Jozee and Pippi and the Havanese. The Pippi and Jozee go to a different groomer. The Havanese, his groomer has been with him since we got him, and now he's getting little lumps on his, lumps and bumps all over. And I think the second last grooming, she noticed a scab. Actually, she nicked it by accident because she didn't see it. It was under the fur. And there was a bump on the side of his face. And she stopped and she called us right away to tell us. And so we took him to the vet, and she stopped the grooming. She didn't do any more around his face. She finished off his body, didn't do any more around his face. And then when we took him to the groomers, it turns out the nicking was an accident for sure. Or she wouldn't have called us if it wasn't. And the vet just gave us some stuff for it, and it hasn't gone away. It was under his collar. So we thought maybe it was irritation from the collar, because he wears a collar quite a bit. But your groomer, if there's something like that, they need to notify you almost right away. An exception to that, well, she's at the groomer, so you're going to pick her up. It's not like you're out of the country. I've had dogs here when their owners have been out of the country and something happens. Unless it's a life and death situation, I don't call the owner, but I call them as soon as they're back from their holiday. And the reason I don't call them is because I don't want them worrying about that when they're on their vacation. If it's not life-threatening and it's not permanent, and I've dealt with it and I can continue to deal with it, I'm not going to ruin their holiday, because I know if it was me and someone called and said, because this has happened to me actually, your dog has split his pad. Okay, so I'm going to be thinking about it the whole time. Oh, did they glue it? Did they wrap it? Is he still walking? So, but your groomer should have called you. And since she didn't, and that's a serious injury in my books, I'd be finding a new groomer. There's lots of them out there, and they're good. And then you set the criteria when you take them in there and say, look, here's been my experience before. He's a good dog in the groomers. He likes to be groomed, and I want to keep it that way. So I want you to let me know if something happens, because I understand accidents can happen, but you need to tell me. And just make it transparent. Put them on notice, because that's what's something that Michelle _ I'm not sure what you're asking me here. What's something that you use to what I use a long line to make them come back. To make them, I don't yank on it. I just guide them. As soon as they turn to me, and I'll back away. I use body language, so I back away. And if they're reluctant, I might turn and run away, because they're social animals. They're going to want to catch up. I don't know what kind of dog it is, but if you have a relationship with her, so she understands that she wants to be with you, and she knows that you get her, and there's a whole process to get to that point, you can still have it happen, then she is going to pick up on that fairly quickly. But get the line on her. She shouldn't be anywhere without a line on. You can practice in the house, but it's not the same, because in the house there's no distractions. Outside, dogs see the world through their nose. That's what's drawing her attention, is the smells. So you want to be bigger and more important and more relevant to the dog than what she's sniffing. And that's a tough thing to do. So you want to be sure that. I mean, generally, I'm have acreage here, so it's easier. But I just keep walking, and then if I see that they're not paying attention, I'll hide, because inevitably, and I hide where I can see them, but they can't see me. Inevitably, they look up, and then they look around, and they go, "Oh my God, where is she?" And they come running, and then as soon as I don't call them until they get to me, and then I say in the praise, "Good come, that's such a good come." So they hear that come word all the time, or whatever word you use for your recall. And there should be a consistent word for your recall. It's not, "Hey, get in here," or "Hey, Spot, get in here, get over here. Come on, hurry up, let's go." I do use "let's go" for a specific command, which means turn and follow me. Come means come to the front, because I'm facing you. You need to come in. It's okay. I'm not a barrier, and I'll back away. Your language, your verbal cues, dogs are not verbal. They are sensory and visual and sense. So they see the world through their nose, then they use their eyes. They use their ears last, and they don't speak English. So that's why consistency matters. That's why you use the same word for the same action that you want, and you reward it so the dog sees that, hears that sound, and right away Pavlov's dog theory kicks in. There's a sensory and salivation happens, and there's a whole feedback loop there that in the brain going on that says, the last time I heard that, it was a good thing, and I know I'm going to get something when I get there, so I'm going to hurry up and get there faster. But if dogs live in the moment. If you've called her from 30 feet away and she's reluctant, and you have to go and get her, and you back up 30 feet because you want to let her know she's still got to make that distance. And then when she gets in, you give her a blast for not coming. Why would she want to come to you? So regardless of what's happened before, as soon as your dog is on their way to you, and when they get to you, they are good dogs, because whatever happened before in their mind is done. But if you rag on them when they come in and remind them that they weren't good out there, they have no idea what you're talking about. And all they know is that you're just not something that's worthwhile being around. So keep that in mind when next time you call your dog and they don't come. Don't repeat the command because they heard you the first time. You have to walk over calmly, pick up the line, back away. You can get down in their nose if you need to, but then you back away and you get there. I still get them to come to me, even if it's only a few feet. They come to me because then they've done the job I've asked them to do. I don't yank them. I don't correct them. I influence them. And if I have to go between the dog and the fence to move them, then I'll change the command. Then it'll be "let's go," and they follow me. But I want to influence them, not control them. Does that make sense? If that makes sense, type yes or double tap on the screen. And everyone can do that. It's about having a plan, being intentional, and being consistent. There's no place for emotion in dog training unless it's a happy one. If you lose your cool, and I competed I trained retrievers for field trial competition for 2 decades. I saw lots of that. And I saw dogs that never, for some reason, unbeknownst to me, didn't head to the next county because the screaming lunatic on the line was not worth coming back to. But yet they did. Dogs are amazing creatures. So the more you can connect with them on their level, the more you can keep your energy calm and be a person they can trust and respect, the better your relationship will be. And come when called will be a no-brainer because they're going to be there anyway. Generally, a recall, if you've got the relationship with your dog, is rarely needed because the dogs are always looking for you. You want to be that person that they want to be with. I've got 4 of them, and the one that's out there, Jozee with the teeth, maybe that's why she ran away. I don't know. She's out in the yard, but she disappears, but I'm safe here, but I can walk, and within seconds she's beside me, and I haven't called her. She's beside me because I'm a person of influence or interest to them, and that's what you want to be, as a person of interest to your dog. And the only way to do that is to have calm energy. It's not about bribing them with food. You're not buying that relevance, and you're not selling your soul to them. You're being like them. You're acting like a dog when you stay calm, when you move, when you engage their nose, and they see that. And then you can add the verbal, which is our language, but when we're consistent, it connects with their sense of, "Oh, this was a good feeling." That's what you want them to know. All right, we're getting close here. How often should we be doing ear cleaning? That's another good question. So it depends on how aggressive you are with the ear cleaning. I generally, I don't do it at all, to be honest with you, unless I have a dog that has a problem. So if I have, in the summertime, if I have dogs that are in and out of the water, I don't clean Prince's ears because he has those pointy ears and they breathe. It's the floppy-eared dogs that you have to be mindful of, or dogs that have seasonal allergies. And I would ask your vet about that, because you can do it too much. And what happens is earwax in a dog's ear has a purpose. And if you're constantly in there digging at it, it can be irritating. It can be counterproductive. So, every 2 weeks is probably the most. But if you've got a dog that's got, it's in and out of the water, I have a little golden, he's coming in a couple weeks, Hawkins, and he has major ear problems. So I just checked him. But I still don't want to put they have an antibiotic drops that go into his ears because he's allergic to everything. But in the summertime, when he's in and out of the water, I dry them first, and then I'll put, there's something called Epiotic. It's like an ear dryer. It dries up the moisture gets in their ear, trapped in their ears. So every time they come out of the water, if you've got a floppy-eared dog, I would be drying their ears, and then seeing if they need to be cleaned. But then otherwise, a regular maintenance might be once a month, or in the summertime, once a week, or once every 2 weeks. It depends on the dog, and it depends on the ear shape, and it depends on what sort of the history of the dog, how much trouble it has with its ears in general. I hope that makes sense. Yeah, once a year. Mine. Oh, yeah, once a year on your ears? Yeah, just keep an eye on them. If you see something, then, Pippi doesn't like her ears to be touched, so I touch them. But, Jozee's, I don't even look at them. Max, because he's got floppy ears, I look in them, but I don't touch them if they look okay. And sometimes probably a vet will tell you that oftentimes the infection's down in here. But usually there's an inflammation and the dog starts to scratch, so you'll know that ahead of time. And once again, you can clean them, but oftentimes if it's that deep, you'll end up at your vet's. So only brush on the brush side of the teeth. Yeah, so that's where the plaque builds up. If you can get it from the outside, it may come off on the inside, but if you can get your finger in there and move all around, then you can massage their whole mouth. So that's the problem. All right, so Michelle, any tips for getting your dog? I want to tell them to. Yeah, we talked about that. Sorry, I'm getting some duplication here. So if you're just joining us and you've joined in late and you brush your teeth every day, absolutely. Yes, you should brush your dog's teeth every day if they have plaque buildup. Then you can, if you skip a day, it's not a matter of life or death, but if you can get that massage, that gum massage going on once a day, pick a time, might be after breakfast, probably after dinner when your day is coming to an end and you're slowed down. You don't want to be in a hurry when you're doing that. You want it to be an experience, kind of like a massage. You want them to enjoy it. So once a day is great. Yeah, that's a good question. Yeah, so Michelle, Golden Doodle, they are known for, if they can blow you off, they'll blow you off. So you've got to get back to it. And that means you've got to have, good, I'm glad I helped you. Get that line and just don't allow them to disobey, but don't lose your cool. Just recognize, be prepared for it to happen, for one thing. So I have a 15-foot line. I don't tighten it. I have about this much slack, but I'll stand here and I'll say, I don't know what his name is, say, Doodle, come. Or, and I'll start to back away, Doodle, and I'll say it with enthusiasm. First of all, I'm going to walk up. I'm going to make sure he knows I've been there. I might offer food, whatever. I've gone through that whole ritual before. So that pretty soon and then I start, I'm not 15 feet. I'm only going to stand part way. I'm going to start close. So I absolutely know for sure he's heard me. And then I'll just say, guide him as it could come. As he looks up, good come. He's going to get fed. Then I'm going to start to sandwich it. Doodle come. And then he starts to come in, good come. And then Doodle come, and then good. And he comes in, and good come. And then pretty soon I just come, good dog. That's it, good. But it might take you 3 to 6 months, who knows. But be consistent. Don't let him not come when you've asked him to come. At 6 years old, he probably knows the sound, but it might not have always been consistent, or your voice might not have always been consistent. So pick a cue, make sure everyone in the family uses the same cue, and follow through with it. And then he'll start to pick it up. So if you're just joining in, I see some people just joining in here. We've been talking about February is Dog Dental Health Month, and I put together a little ebook for you. There's no charge for it. Just type teeth in the comments, because I want every dog to have a healthy mouth, because a healthy mouth is a healthy dog leading to healthy training. We talked about why we're talking about health, dental health, and training in this podcast, because I'm a trainer. Well, any dog that's experiencing any kind of pain at any level can't focus on its training, or if it's got an upset stomach, or if it's got an ear infection, or particularly if it's got a mouth that's on fire. The last thing they want to do is train. And some dogs, you might take them to an obedience class, or you bring in a trainer and the dog's just not interested. Like, it's just like, whatever, when are we done? there's a good chance there's something going on. Maybe there's an ear infection. Maybe that's where the dental health shows up, because the dog they're not going to limp. They're not going to shake their head because it hurts. They're just going to stay still, and they might freeze. So it might be, and if you can't get inside their mouth to take a look, even if you can, your vet will see things that you can't see. So book a vet appointment if that's your dog. All right, folks. I appreciate. Oh, I got 2 more questions here. I did that. Okay. I appreciate everybody joining in. Just type, fifth group. Yeah, interesting. Yeah. So her ears, and she clipped her ears and then didn't tell you. Yeah, 5th groomer. You know what? Like I say, there's lots of groomers out there, and work until you find a good one. Ask for referrals if you need to, but that's not always the case. Groomers are like dog trainers right now. Like the pandemic just sprung up a whole bunch of people that think they are. And there's no licensing or regulation on that. So everybody and their brother that thinks they want to make a fast buck is going to do that. And that's what it is. And yet they're terrible at it. And it's not, when you're good at it, it's a living. But you're not going to be a millionaire at it. It's a living. My groomer, I mean, I love her to bits. She takes Pippi, and me would think a little dog, she's going to be ready in a half an hour. She takes 4 hours, because she'll bath her and then she'll let her relax. Then she'll brush her out, then she'll let her relax. Then she'll do her feet, then she'll let her relax. Then she'll look at her ears and trim her ears, then she'll let her relax. Like, she's always giving the dog a break. Your groomer, if they're good, should take at least 2 hours, regardless of the size of your dog, because they need to have a break in between. Even our little Havanese, and she's pretty thorough with him, they have downtimes in between. And if he starts to get too antsy, she'll put him away, and then she'll get him back out again. So if you're in a groomer, like, I'm not going to mention any companies here, but if your groomer is on a volume basis, go somewhere else. You want to have a personal relationship with your groomer, just like you have with your vet. You don't want to be treated like a number, and you don't want to be disrespected by having them injure your dog and not telling you, because that's disrespect. Not to mention not trustworthy. Well, that's it for another week, folks, of Karen Laws Live, the Paws and Profits podcast. We talked about your dog's dental health. Why would a dog trainer talk about dog dental health? Simple. You heard it in the comments. You heard people asking the questions. Because if your dog has a headache based on bad teeth, they're not going to pay attention because they can't focus. So hope you enjoyed the show. Hope you entered teeth in the comments to get your copy of our downloadable ebook, free for you, just for joining in and listening to this episode. And we'll be back again. And remember, training time is all the time. And keeping your dog's mouth healthy, their gums clean, their teeth shiny, is going to give you a dog that is so happy and willing to work with you. I'm Karen Laws, the Ontario Dog Trainer. Thanks for joining in. We'll see all of you again in the next episode.